This is Heather Livingston. I'm going to introduce our project. The community resource we selected was the Care Clinic. My classmates that are on this project with me are Chelsea Hunt, Kristen Hunt, and Kyle Madruga. So the Care Clinic cares for several populations. You have to be a resident of North Carolina. They offer care to individuals without insurance, care to individuals with low-income populations, and they must show proof of the income. Patients must provide a valid North Carolina driver's license or issued ID, and it must have their current address attached. Requirements for the income are 200% less than poverty level. The proof of insurance comes in a form of a W-2, a bank statement, or a previous 1040 tax paper. The care provided is essential to patients as if they were their primary care provider, and the care is for ages 18 and up.
Hello everyone, it's Chelsea. Next we're going to talk about what services the Care Clinic provides. They offer basic medical care for patients who are coming in and have a history of hypertension or diabetes. They're able to offer assistance with that, acting as your primary care provider. They also offer dental extractions, lab testing, diagnostic testing, pharmacy assistance, health education, community information, social services, and referrals. The Care Clinic refers patients to hospitals and surrounding facilities to get different types of imaging and testing done. Some resources are at Valley Radiology, Cape Fear Valley Health, UNC Chapel Hill, Carolina Imaging, and Highsmith. They're oftentimes looking for ways to connect with different area hospitals and facilities to get their patients in and be seen for chronic issues and for things that they're not able to assist with in the clinic. The next slide, we're going to talk about what care they do not provide. Severe injuries, so like a patient that would come in and possibly have been stabbed or a gunshot wound, that would be something that they would need to go to the emergency room for. They do not offer OB and GYN. They're not able to assist because it's more of a specialty. Also, chronic diseases, mental health, wound care, financial assistance, and they're also not able to fill prescriptions from other facilities. However, if the patient was to come in and establish care at the Care Clinic with one of the providers on site, they would be able to assess the patient's medical issues and then possibly help with getting them a new prescription for said issues. They do not provide controlled substances. However, they do refer out to pain management clinics. And they also do not have a social worker at this time. So they're looking for volunteers. They're always taking volunteers. And we'll talk a little bit more about that in a future slide.
My name is Kristen. In this part of the presentation, we're going to talk about some of the operations of the Care Clinic. So you can make an appointment by phone. The number is listed here on the PowerPoint that you can call to make an appointment. They take medical appointments Monday through Thursday from 9 a.m. to 2 p.m. They provide a dental clinic on Fridays from 9 a.m. to 12 at noon. And you have to call the week prior to make an appointment for the following week. They do not take walk-ins, and appointments are a first-come, first-served basis. So on Tuesdays, they have a diabetic clinic. They draw labs and provide nutritional support by a dietitian. On Tuesdays and Thursdays, they have an evening clinic that starts at 5 o'clock. There is no specific end time to this clinic. They just continue the care until they've seen all the patients that they have scheduled for the day. And they will soon be starting a physical therapy session when they get everything lined up for that. Now we're going to talk about funding to the Care Clinic. Funding is provided by donors, grants, and fundraising events. Patients can also make a donation at the time of their visit. Some of the fundraisers that they hold are the Care Dinner, the Toast of the Town, and Silent Auction, and the Golf Charity. Some upcoming events they have, on May the 5th, they have their 22nd annual Toast of the Town. This is a wine, beer, and spirit tasting at the Cape Fear Botanical Gardens, and the event is from 6 to 10 p.m. And then they will be having their 28th annual Golf Charity on Thursday, September the 15th, and this will be held at Gates for Golf and Country Club.
Hey, this is Kyle. This slide's going to be about how you can contribute. They do take donations. They take donations via PayPal on their website. You can also mail them in. That can also be found on their website. They're also looking for volunteers. They're looking for pharmacists, pharmacy techs, physicians, physician assistants, nurses and nurse practitioners, nutritionists, dentists, dental assistants, and social workers. They also have a wish list of supplies detailed here. Some other needed items are also going to be blood pressure cuffs, lancets, glucose test strips, and glucometers. For us, as students, we can also volunteer with the Care Clinic. If you're interested in that information, you can refer to the contact information slide up next, which will detail how you can get in touch with them and organize that. Here's their contact information. You'll find their address at the top. It's 239 Robinson Street, Fayetteville, North Carolina at 28301. If you're interested in contacting for donations or volunteering, they prefer to be contacted by email. Their email is listed here. It's care@thecareclinic.org. We'd also like to say a thank you to Michelle Garrity for taking the time to sit down with us. Her insight to the daily operations and the behind-the-scenes stuff at the Care Clinic gave us much needed information to help make this project successful.